Coronavirus cases breaking records around the world. The last week of the year has seen an unprecedented surge in infections as the Omicron variant strains infrastructure and mental health over the holiday season. I'm Andrea Sankey, and our newsmaker of 2021 is COVID-19. The World Health Organization is warning of a tsunami of cases worldwide. Global infections have more than doubled just this week, with more than 1.5 million positive cases a day. In the U.S., someone catches COVID every 3 seconds. In France, 2 people per second are testing positive. Now, the lightning-fast spread is attributed to the highly transmissible Omicron strain, but the previous variant of concern, Delta, hasn't gone away. And with both circulating at the same time, the WHO is worried.
Right now, Delta and Omicron are twin threats that are driving up cases to record numbers, which again is leading to spikes in hospitalizations and deaths. I'm highly concerned that Omicron, being more transmissible, circulating at the same time as Delta, is leading to a tsunami of cases. But I still remain optimistic that this can be the year we can not only end the acute stage of the pandemic, but we also chart a path to stronger health security.
At least 9 countries across Europe recorded their highest ever number of cases on Wednesday, including Italy, Spain, and Portugal. In Greece, cases tripled in just 48 hours. The worst hit so far has been France, which reported the continent's biggest ever daily toll at more than 200,000 people testing positive in just 24 hours. The French government plans to mandate vaccine passports in public venues, and people will be required to wear masks outdoors or risk a fine. The UK is also being hit with record cases, but is not introducing any additional restrictions until the new year. After January the 1st, the government will reassess the situation. But health ministers across Europe are asking everyone to be cautious over the New Year holiday.
With this decree, we are also banning parties and events in public squares until the 31st of January, with the clear aim of avoiding gatherings, which can be particularly dangerous, especially during the holidays.
The protective measures we are currently using, which are quasi-successful in countering the Delta variant, those measures will not be enough to prevent a significant increase in Omicron cases. I therefore appeal to citizens to be very careful during New Year's celebrations, so that we don't allow additional chains of infection. Please celebrate in very small numbers and do not endanger each other, because the current reported incidence of cases underestimates the danger we are currently in.
We won't be taking any further measures. Of course, people should remain cautious as we approach New Year celebrations, and take a lateral flow test if that makes sense. Celebrate outside if you can. Have some ventilation indoors if you can. Please remain cautious. And when we get into the new year, of course, we will see then whether we do need to take any further measures, but nothing more until then, at least.
Concrètement, à compter du 15 janvier 2022,
as of January 15, 2022, it will be compulsory to show proof of vaccination for access to leisure activities, restaurants, bars, fairs, seminars, trade shows, and interregional transport from the age of 12.
Well, early findings suggest Omicron may cause milder symptoms than other variants, meaning you're less likely to end up in the hospital. But scientists are concerned that the sheer number of positive cases will cause untold strain on societies and systems, and we're beginning to see that play out. Positive cases have taken a toll on essential services. Airline staff who are sick or in isolation forced the cancellation of thousands of flights this week, and hospital workers from the UK to US states like Missouri say there just isn't enough staff to keep COVID wards operational. Canada is trialing an unusual and controversial response with some healthcare workers who are COVID positive being kept on the job. Quebec's health minister says it's the only way to keep their healthcare system afloat. Meanwhile, the Australian government's solution to the strain has been to plead with people to get tested less often.
If you're anything other than a close contact, and you're not symptomatic, you don't need to go and get a test. Now, I know this is a bit different to what you've been hearing over the last couple of years. That's the gear change. That's the reset. That's what we need people to really understand. And I know it's a change from what has been said, but dealing with Delta is very different to dealing with Omicron. And to ensure that our public health systems work as effectively to keep as many people safe as possible, that's why we need to make this change. We cannot have hundreds of thousands of Australians and more taken out of circulation based on rules that were set for the Delta variant. We need rules for the Omicron variant so we can keep our economy working, we can keep people in jobs, we can keep Australia open, and we can focus the resources that we have on the tasks that are most urgent. End of the day, get your booster, monitor your symptoms, check in where you're going, and use common sense to manage your health responsibly and that of your family.
Well, using common sense to manage your health responsibly sounds great, but there's no real agreement over what that common sense is. So to discuss this latest tidal wave of cases and what needs to be done, I am joined from Pretoria, South Africa, by Dr. Angelique Coetzee. She is the chair of the South African Medical Association and was the first person to detect and raise the alarm about the Omicron variant. Professor Lawrence Young is in Birmingham. He is a virologist at the University of Warwick. He's also one of the most cited scientific researchers in the world. And Irene Petersen is in the Danish city of Aarhus. She is the professor of epidemiology and health informatics at University College London. Thanks all so much for being with us. Dr. Young, you are in one of the countries where the Omicron variant is spreading exponentially. So tell us first what you make of, one, the government's guidance here, and two, how Britons have been behaving.
Yeah, so the guidance has been very mixed. Messaging has been very confused. We have a situation where there are different rules, regulations and restrictions in Scotland, Northern Ireland and Wales compared to mainland England. So there is a lot of confusion, I think, around the messaging in the UK. Having said that, I think on the whole there we have seen that people are being very cautious in the United Kingdom. But in England, as I say, in the absence of government mandated restrictions, people are being cautious, but perhaps are rather confused about what to do, particularly in the light of some of the challenging issues, not only related to the high levels of infection, but also struggling now to get tests. And so both PCR testing and lateral flow testing is becoming a real issue now.
Okay, so Dr. Young, what would you describe as common sense here? And how do you actually explain the discrepancies between how all these different governments are responding to these outbreaks and this tidal wave of infection between various European countries and the UK?
Yeah, it is very confusing. And of course, it's an interesting balance now between attempting to restrict the spread of the virus by various behavioral changes versus giving us enough time and breathing space to vaccinate. We know that booster vaccination is going to be really important in preventing severe disease. We also know that whilst the Omicron variant appears to be milder than Delta, it still will result in significant disease and burden for our health system. So the important thing here is both to suppress the spread as much as we can using behavioral measures, face masks, avoiding gatherings in large groups in poorly ventilated spaces, etc., alongside getting as much of your population vaccinated as possible.
Okay. Let me turn to South Africa. And Dr. Coetzee, part of the challenge in South Africa isn't just, vaccine hesitancy. The rate of vaccination really isn't as high as it really needs to be to fight this pandemic properly. But you said before, it's actually a matter of getting the vaccines to the people who can't get to them. First of all, tell us if that is now being worked on in South Africa, if you're pleased now with the response and how the variant and its exponential growth is being managed.
Yeah, that's a good question. In South Africa, everything is stands still during festive holidays this time of the year, and it's going to take 2 more weeks in the new year before anything is going to happen. For now, no, the vaccines is still not going to the people. They're still trying to get the people to the vaccines, which is not going to work in the end of the day. We have said many times before, these vaccines should be given to the general practitioners at their healthcare facilities for us to be able to vaccinate our patients. So currently, there's, I think, 5 general practitioners, if I'm not mistaken, in the whole of South Africa administering these jabs because of various difficulties put in our ways. And we as family practitioners just at one stage said, okay, we had enough of this. We were willing to help and assist. Because what we have seen is people trust their doctor. So even if I had this week vaccines in my surgery, I would have been able to vaccinate all those people who was unvaccinated. Because once if you ask them and they are willing, which I have seen, but they're not willing to go out and to a pharmacy or a clinic, you're losing those patients. So no, we are not doing what we're supposed to do.
Okay, and what could be the consequences of that?
Not vaccinating, that's easy. People are inherent distrustful. So people are afraid of needles. There's a lot of reasons, and not so much the fact that they don't trust the vaccines. Because if you start to explain to them, we have seen they are more than willing to take the jab. And then the next question is, doctor, can I get it from you? Unfortunately, they can't get it from us. And that is a huge problem.
Okay, and so what worries you then? Especially, okay, you're midway through the summer now in South Africa. What happens when the cold season hits? People are going to be spending more time indoors, and they're still not going to be vaccinated.
Yes, that's going to happen. We will still try to get vaccines into the arms of the unvaccinated people. We are going to again sit with National Department of Health and get them to make it much easier for general practitioners to get these vaccines. We have to buy the vaccines, and it's extremely expensive. It's not like in the first world countries where the government supply that to the various clinics. In our case, in all the private clinics, you have to pay for it, and we cannot afford it.
I want to talk more about some of potentially the new vaccines on the market as well that they're looking at distribution to developing countries. But first, let me get to Irene Petersen, because let's look at as I like to put it, the silver lining, if there is one. We know this virus doesn't want us to die because it needs a host. So it's in its own interest to become more infectious, but also to weaken. So are we now finally transitioning from the pandemic to the endemic coronavirus?
I don't think we are quite there yet. And also remember, it can be that it will be less severe in some people, but also we see that people who are unvaccinated or haven't had a previous infection, it can still be quite a severe infection. So let's not celebrate too early.
Okay. Dr. Young, are you on the same page? We're not there yet? Do we still have ways to go, or is there the sun coming up on the horizon now?
Well, I still think we have some ways to go, and what we're seeing here is yet another variant, and we can't be complacent about the ability of that variant to cause disease in the vulnerable, particularly those people whose immune systems aren't as effective at combating the infection. But there is a school of thought in virology that as a virus evolves, and what we're seeing here is evolution of a virus in real time in a way we've never seen before, then it will adapt to our bodies, it will become more transmissible, and hopefully less pathogenic. But I don't think we're anywhere near that yet. What this demonstrates, however, is how important it is that we get vaccination out to the whole world, that as long as the virus continues to spread, it will continue to mutate.
Right.
And it's in all our interests to make sure that countries like South Africa have adequate supplies of vaccine.
I mean, we need at least 85% immunity, from what I understand, for this pandemic to end. How close are we to getting at least to that number, with record infections now and the vaccines?
Yeah, I'm not sure about this concept of herd immunity or 85% immunity when you've got a virus that can reinfect even if you are immune. And the big issue at the moment, of course, is about the effectiveness of vaccines, the waning immune response, and whether or not we need to be thinking about, as companies and scientists are now, about second generation vaccines that will provide broader, more long-lived immune protection. So it's still hard to say as to what degree of we need to get a population vaccinated. All we know is the more people that are vaccinated, the less the virus will spread and the less chance it has to change.
Right. Irene Petersen, let me come back to you, because in this effort to try and get the world vaccinated, we're seeing this, massive protection of patents and refusal to share the technology with developing countries that could essentially make their own vaccines. So how much is that refusal to share patents for vaccine production really preventing the world from getting vaccinated and ending this pandemic?
I think that is actually one of the main obstacles at the moment. And I cannot understand why there's not more pressure to allow other countries to produce and distribute their own vaccine. Any person with a little bit of common sense would go in that direction. It would be a benefit for all of us.
Right. It's hard to reconcile that. But are you finding some encouragement when you're hearing about the new vaccines that might be coming onto the market globally soon? We have Novavax, Turcovax. There's even a Cuban vaccine that is looking to get free distribution in South America?
I think there is a good chance that some of these vaccines will make a difference, and it's also going to be interesting to see how they will be distributed. But yes, they can't continue in the way they're doing now.
Right. Dr. Coetzee, how encouraged are you by the fact that these newer vaccines, and it's also good to mention that, arguably good to mention that they are not mRNA vaccines. These are of technologies that people who are vaccine hesitant might not be as afraid of because they tend to think the mRNA is untested, and I don't know. There's a whole lot of conspiracy theories behind that. But yeah, do you think it could be really good, maybe a game changer to get these different vaccines on the market as quickly as possible?
Very good question. I'm a very practical person. If I listen to all these vaccines and I know how difficult it is to adhere to the refrigeration storages of these vaccines, and how, it's not that easy to reconstitute these vials and then, syringe a tiny amount into a syringe. Then I'm always wondering, who will benefit in the end of the day? Definitely not Africa. I can speak on behalf of Africa because I'm an African myself. I can promise you what we rather need to look at is to get tablet forms, nasal sprays, anything that doesn't need refrigerating, that doesn't need to be reconstituted when you want to administer it, that doesn't need to be traveling in specific logistical trucks that make sure that it's cool. The temperatures in Africa is very high. The storage facilities is not there. And, if we don't get something better than an injectable, or if we don't get an injectable that is with normal storages, who doesn't really need a cold chain, we're not going to get anywhere in Africa. But it's always good to get Africa vaccinated.
Okay. Dr. Young, just very quickly, if I wanted to hear your thoughts on the new vaccines that are hopefully hitting the market soon. Do you think those can make a fundamental difference to getting the planet vaccinated, or is it too limited an impact?
No, I think honestly, the more variety of vaccines we have, the better. As long as they're all properly clinically tested and evaluated for safety, then the more we can get manufactured vaccines out to the world, the better. There are some really interesting developments around both the cold chain requirements as well as broadening the scope of these vaccines so that they're more effective and provide a long-lived, perhaps even sterilizing immunity, complete protection. So my view is we will see some really exciting developments in the next 6 months or so. The worry is it's a race, and we're racing now between the virus spreading and changing, and as many people getting vaccinated as possible.
How worried are you, honestly, about the new mutations and the chance of some mutation coming out that could actually be as devastating as Delta?
I think we're in a situation where, with a highly vaccinated population, things should be okay. The problem is we haven't got a highly vaccinated population, and what we've seen with Beta and with Omicron from sub-Saharan Africa and other countries is these things can change very rapidly and spread. With Omicron, it's hard to imagine anything has mutated. So whether or not we've reached peak transmissibility of the virus, peak infectiousness, is an issue. But I think we're in such a strong position now because we can rapidly develop and deploy vaccines. We have drugs, and the several drugs that are now out and about, these antivirals, are going to be effective against Omicron. But again, we must make sure that the rest of the world has access to those drugs.
So just very quickly, Dr. Lawrence, I mean, there are some who are saying that vaccines and immunity through just natural infection have actually really broken the connection between infection and hospitalization and death. Would you confirm that we're at least there?
Oh, of course we are. I mean, if you just look at the current high levels of infection we have in the UK, unprecedentedly high levels, and if we go back a year to where we were in terms of hospitalizations, we're seeing nothing like the level of hospitalizations as related to the case number. So, of course, we have significantly weakened the leak. We haven't broken it completely, but we've weakened it, and there's no question at all.
So
that's
Irene,
all the vaccines.
Yeah. Irene, I mean, how close are we then to this just becoming a virus that we're going to have to live with? We can have, no restrictions. It will come down to individual responsibility, and things like shortening the isolation period, like they've done in the United States, from 10 to 5 days. Even that won't be necessary. How far away is that?
Well, I think there's still some way to go. In Europe, we are just at the foot of the Omicron mountain, and we will see very different, there will be high hospitalization in some country, and in particular in countries where you have a low vaccine uptake and where there has been a relatively low infection during the last 6 months. They are going to struggle in that period. And I mean, you can see that in the Netherlands, there have been lockdowns, and in most European countries, there are some kind of restrictions, which is going to last for the next couple of months. But on the other hand, I think when we get to the spring, life will look different, except if you get a new variant that is even more infectious.
Always that if. Okay, Dr. Coetzee, I just want to ask you quickly about some of the measures that have been taken both in the northern and southern hemisphere. We talked about Quebec keeping some COVID-positive healthcare workers on the job, saying it's the only way to keep their healthcare system working. And then over in Australia, suddenly the testing system seems to have almost collapsed, and they're discouraging people from getting tested. Does that worry you?
We in South Africa is very clear. No symptoms, no testing. I don't know what you test if you don't have symptoms. It doesn't help me at all. It doesn't assist. So, South Africa, no symptoms, no testing.
And you're okay with that?
In fact, I'm okay with that. Because we're wasting resources, we're wasting money. A negative test with no symptoms doesn't mean anything. It doesn't tell me that you're not going to get it in 2 days' time. A positive test with no symptoms also tells me nothing, because we keep on saying that the PCR tests can't distinguish between live viral particles and dead particles. So no symptoms, no testing. It's easy.
Okay. And Dr. Young, I'm just curious about what you make of Quebec's policy to actually keep COVID-positive healthcare workers on the job.
I think it's really a really dangerous thing. But, we're seeing so much pressure now. We've got this problem in the UK with so many people off work because of COVID, having to isolate. And that's really impacting the National Health Service. And so I can sort of understand it, but I think it's a very worrying development.
And what about the testing for you? Because you'd stressed in the beginning that, testing and understanding how widespread it is really matters. But testing isn't exactly easy for everyone.
No, it isn't. And that's the real problem. And I think, lateral flow tests are really important. They do tell you whether you are infectious. They're not as sensitive as the PCR test, but that doesn't matter because they tell you whether you are, whether you're going to infect somebody else. And so that's quite an important thing to be using as a tool in both in relation to how long you have to isolate if you are infected, but also if you have any concerns about mixing. And it's a good way to control the spread of the virus. But of course, again, not everybody has access to lateral flow tests. And even in the UK today, people are struggling to access lateral flow tests.
But is a policy of no symptoms, no testing okay?
I worry about that. I think we've got a situation here where if you're in contact with somebody who knows positive and then you take a test and you're negative, that's fine. And if you're vaccinated and boosted and you're in touch with somebody who's positive, that's fine. I just worry. But I perfectly appreciate that this is going to depend very much on your healthcare systems and the availability of testing. And that varies so much again, as does vaccination.
Okay, Dr. Young, you will have the final word. I'd like to thank really all three of you so much for being with us on The Newsmakers, and our viewers, of course, for tuning in as well. Remember, you can follow us on Twitter at @the_Newsmakers, and be sure to subscribe to our YouTube channel. I'm Andrea Sankey. We'll see you next time.